Hi guys, and welcome to Renal Basics. My name's Steven. Let's get started. So first things first, we're going to be using the Curvilinear Probe for this exam. Starting out with the right kidney, because of the position of the liver, this one is actually a little bit lower and a little bit more anterior than the kidney on the left. So what you're going to want to do is go to the lowest intercostal space and probably about mid-axillary line to find it. Usually when you put the probe on, you're going to see it right away. What you'll see is you actually have liver and then kidney right behind it. So from the probe's perspective, you see liver here and then the superior margin of the kidney right there. So you're going to notice that first. We'll put the ultrasound up here. So liver's there, and then you see kidney coming into view down here right behind it. So that's all kidney. And then obviously you just fan through one side to the other. So one thing I do want to bring up is in this image, this patient has hypoechoic pyramids. So here you see these black things. These are the renal pyramids, and they are in the cortex right here. So the two things you really want to identify is the renal pelvis and then the cortex up here. Sometimes you will see pyramids and sometimes you won't see pyramids. So here, this is a normal medulla and cortex and a normal pelvis, but you don't see pyramids. The only reason I'm really talking about that is because those pyramids are not hydronephrosis. So a lot of people will see those little pyramids and say, oh, they have mild hydro, but that's not the case. And it's because the collecting system actually has to be dilated for hydronephrosis, which is backup of fluid into the kidneys, to be diagnosed. So here you see that the renal pelvis and the calyces are starting to get dilated in all these images. We have mild hydro, moderate hydro, and severe hydro. I'm not going to spend too much time on this here. We'll talk about it in the pathology series. But I just want to bring up that image so that you know that these pyramids without dilation in the pelvis don't represent hydro. These two patients side by side, this is actually the same person. And here you can see the pyramids on the right. And then on this one, it's labeled left kidney. You can see that the middle's all dilated. So he actually had hydronephrosis on the left kidney, but there's no hydronephrosis there on the right kidney. So to image the left kidney, this one is going to be a little bit more superior and posterior. So you're going to go up to probably the second most inferior intercostal space and to the posterior axillary line. Again, you should see the kidney usually pretty quickly. You're going to shoot through the spleen and see the kidney right behind it. So that's what it's going to look like. Spleen there, kidney there. And we see spleen up here. And then you see the kidney coming into view right down here. So that's basically all you have to do to see kidney on either side. You're obviously going to rotate 90 degrees and fan through, get a short axis view of it as well. You should do that with pretty much everything you're ultrasounding. Now, the last portion of a renal scan is to check out the bladder. So the problem I see people getting into with the bladder is the pelvic bone right here. So this pelvic bone will cast a shadow into the from the ultrasound. It won't be able to get sound waves through it. So you have to go above it. So sit right above the pelvic bone and aim inferior. So you really have to go kind of deep inferior into the pelvis to see the bladder. So if you're not able to image it, you're probably just not looking inferior enough, or the bladder could be empty. But you're going to image the bladder in two planes. A full or moderately full bladder is going to look like this, a square right here in transverse, and it can take different shapes in the longitudinal axis. But obviously, after you image it in transverse, you want to rotate the probe 90 degrees towards the patient's head and do another fan through in that direction. So that's it. That renal ultrasounding is pretty simple. It can be really helpful differentiating your flank pain patients in the ED, so go out there and have some fun.